Good evening all. Let's discuss about approach to sleep disorders and polysomnography today. So firstly, what is sleep? Sleep is a natural periodic state of rest for the mind and body in which the eyes usually close and consciousness is completely or partially lost, so that there is a decrease in bodily movement and responsiveness to external stimuli. Sleep is a state of unconsciousness but still able to awaken by normal sensory stimuli. What are the functions of sleep? Memory consolidation, wound healing, body repairs itself during sleep, immune function, energy restoration, and hormonal consolidation. Pictorial representation, tissue regeneration, memory consolidation, cardiovascular health, hunger control, strengthens immune system, hormonal balance. Stages of sleep. There are two stages, NREM and REM. NREM sleep constitutes 75 to 80%. It is non-rapid eye movement sleep. It is also known as slow wave sleep. It constitutes about 75 to 80% of sleep, whereas REM sleep is only 20 to 25%. It is rapid eye movement sleep. It's also called paradoxical sleep or desynchronized sleep. It constitutes around 20 to 25% of total sleep. REM sleep is also called slow wave sleep. It constitutes about 75 to 80%, and there is 10 to 30% decrease in the BP, respiratory rate, and basal metabolic rate. It is frequently called dreamless sleep. Dreams in this slow wave sleep are not remembered. There are three stages in NREM sleep. NREM stage 1, then transitional phase between wakefulness and sleep. It is the early portion of stage 1 sleep produces alpha waves. Theta waves occur like seen in the picture. Theta waves occur in the later part. Therefore, alpha waves disappear and theta waves appear in stage 1 NREM sleep. It can be easily interrupted by a disruptive noise. Stage 2. During stage 2, sleep spindles and K complex appear. Theta waves dominate. Sleep spindles are these are bursts of activity, frequency of about 11 to 15 hertz. Duration will be more than 0.5 seconds. Shape like that of a yarn needle, like seen in this here. It arises from reticular nucleus of the thalamus. Likewise, K complex, these are high amplitude biphasic wave. There is initial negative sharp wave followed by a positive slow wave. The duration will be more than 0.5 seconds. NREM stage 3, it is going into a deep phase of deep sleep. It is characterized by low frequency, high amplitude delta waves, and delta waves appear in stage 3, and there is fall in heart rate and respiratory rate. Night terrors, bedwetting, sleepwalking, and sleep talking occur in this stage 3 NREM. REM sleep. During this sleep, sawtooth waves are seen. It is also called paradoxical or desynchronized sleep because there is a paradoxical elevation of brain activity and metabolism despite sleep. Eyes undergo rapid roving movements. They constitute around 20 to 25% of sleep. And bouts of REM sleep occur every 90 minutes. Each bout lasts for 5 to 30 minutes. And duration of REM bout increases as the sleep progresses. There is depressed muscle tone, generalized muscular atony, and there is irregular heart rate and respiratory rate. Brain is highly active in this phase, but the body's muscle tone is depressed. Overall brain metabolism increases by 20%, and in EEG, REM sleep shows beta waves. So these are the four: beta, alpha, theta, and delta waves. Awake stage, low voltage, high frequency beta waves are seen. During initial drowsy, alpha waves predominate. During this phase, patient can be or subject can be aroused, can be awakened. In stage 1, theta waves predominate. In stage 2, sleep spindles and K complexes, mixed EEG activity is seen. Stage 3 and stage 4, slow wave sleep, progressively more delta waves are seen. In REM sleep, low voltage, high frequency waves are seen. Sleep cycle. The NREM and REM sleep cycle repeat several times a night in a cyclical manner, that 4 to 6 times depending on the length of sleep. A typical cycle starts with stage 1 of NREM sleep, followed by second, third stages. After this, the sleep returns to stage 3 and stage 2. The first REM sleep occurs now 70 to 90 minutes after the commencement of sleep. Sleep latency, the time from lights out to the first epoch of sleep. It can be around from 10 to 20 minutes. REM latency, time from sleep onset to first epoch of REM sleep. It can be around 60 to 90 minutes. And graphical pictorial representation, falling falling asleep, stage 1 and stage 2, in between REM sleeps. Okay. And this is the circadian rhythm. You can pause the video and see. Orexin neurons excite dopaminergic, noradrenergic, and cholinergic neurons and stimulate food intake, wakefulness, and energy metabolism. They are also involved in arousal, and deficiency of orexins lead to sleep disorder, narcolepsy. Sleep disorders can be broadly divided into these: sleep apnea, snoring, narcolepsy, sleep paralysis, sleep talking, restless leg syndrome, insomnia, exploding head syndrome, so on and so forth. Classification of sleep disorders. International classification: insomnia, chronic and short-term; sleep related breathing disorders, central sleep apnea syndrome, sleep related hypoventilation syndrome, and OSA disorders; central disorders of hypersomnolence, narcolepsy, idiopathic hypersomnia, insufficient sleep syndrome; and circadian sleep wake disorders, irregular sleep wake rhythm disorder, delayed sleep wake phase disorder; sleep related movement disorders, restless leg syndrome, periodic limb movement disorder, sleep related bruxism. Bruxism means grinding of teeth during sleep. It leads to degradation of the enamel and late and other disorders also. Parasomnias, NREM related parasomnias, confusional arousals, sleep terrors; REM related parasomnias, REM sleep behavior disorder, nightmare disorder. Parasomnias, they consist of clinical disorders that have undesirable physical phenomena that occur predominantly during sleep. They include arousal, disorders of arousal, partial arousal, and sleep stage transition. Many of the parasomnias are manifestations of central nervous system activation. Except REM sleep behavior disorder, parasomnias can be diagnosed by history alone. NREM parasomnias and REM parasomnias. NREM parasomnias are confusional arousal, sleepwalking, sleep terror, sleep-related eating disorder, bruxism. Bruxism is predominantly seen in emotionally deprived children. REM parasomnias, REM behavior disorder, sleep hallucinations, sleep paralysis, nightmare disorders, and narcolepsy. These are NREM parasomnias. Symptoms of NREM: sleep arousal disorders, sleepwalking. These are episodes varying from quiet walking about the room to disturbed running, attempts to escape threatening conditions or terrifying threats. Patient will be having open eyes with a glassy staring appearance. There are slow or blank responses to questioning. Sleep terrors is short with a frightening scream or shout, sitting up in bed, looking terrified, stare wide-eyed, hard to awaken and be confused if awakened, having little or no memory of the event the next morning. Confusional arousals, confused thinking, poor memory, and blunt responses to questions or requests. REM sleep behavior disorder. They manifest with dream enactment behavior during REM sleep, often associated with recall of dream content than the mirrors observed behaviors. Episodes typically occur during the later half of the night when REM sleep predominates. The finding of REM sleep without atonia and polysomnography is required to confirm REM sleep behavior disorders. Sleep related movement disorders. It is famous leg syndrome, also